Hello, Miss Sue. I'm Sam, Dr. Doe's assistant. He's our surgical oncologist. So you come to us ready for a Mohs surgery. Now, before you got here, you did note that you would frequently get sunburns in the past, as well as nose of growth on your cheek. And it's good that you noticed that when you did, and you came to us when you did, because you might be more prone than others to getting basal cell carcinoma. Now, what basal cell carcinoma is a type of cancer that affects the base of the epidermis or the most surface part of the skin that causes the growth that you noticed. However, it's very common and it usually doesn't spread, but even if it does, we're very experienced in dealing with it, so it's fine. Now, what Dr. Doe will do in this surgery is that he will start by scraping at the apical point of the growth, starting at the epidermis, and he will take the tissue that he has scraped off and perform a biopsy. Basically, a biopsy is a microscopy of any tissue, or a living tissue specifically. What he will do is he will place it under a microscope to put into perspective how many more scrapes might be needed or how many cancerous cells are detected. We're going to repeat this process up until we detect no cancerous cells. So that implies that this procedure might be relatively quick with only a couple hours to relatively long with several hours. Most patients who undergo this process will experience some form of cicatrix or scarring of the incision. And there is the option to reduce this scarring with a form of cosmetic surgery called dermatoplasty. However, I would suggest that you plan that in the future because we do want you to come back in about a week so that we can revise, make sure that everything went all right with the surgery, that your healing is fine, and to make sure that there's no resurgence in any abnormal cells, as well as to remove your stitches, and so we can make sure you're all set. During the time that you are gone, however, you would be highly encouraged to make sure that you keep the wound or the opening clean, and as well to make sure that you don't put the site of the surgery in any more harm than it might need to be. So just care for it. But there's no need to worry. This is considered the most effective form of treating basal cell carcinoma, and well, let's hope that it goes as well as we predict it will. I'll see you later.